Hi, I'm Dr. Jenna Shivers, and this is Miss Mindy Moo. Welcome back to the Lovely Vet. Thanks so much for tuning in. We are still doing our cottage and camping series here, and we're moving on to snake encounters, more specifically venomous snake encounters. Here in Ontario, Canada, we do only have one type of venomous snake, which is the Massasauga rattlesnake. All other snakes are not venomous. The snakes are more afraid of people than we should be of them, because we are certainly more of a threat to them than they are to us. With the Massasauga rattler, there's been 0 cases of fatality with humans in the last 40 years. So realistically, this is not a snake to fear. They are pretty docile snakes. So I'm hopeful that you'll have more respect for these guys after the end of our episode here. As always, we put the timestamps into our episodes so you can scroll through as you like to get to whichever part you like. We're going to cover identifying the Massasauga rattler, the places in which you will find them, how to avoid encountering snakes, as well as what to do if your dog does get bitten by a snake. So thanks so much for joining along. Let's get started. So as I said before, the Massasauga rattlesnake is the only venomous snake here in Ontario. It's considered a pit viper, so it does have pits where it senses heat, and it does have a venom that causes its prey to become paralyzed and does kill them quite quickly. I guess the good thing about these snakes is that their prey is really quite small. Little mice and voles are usually the type of food that they eat. If they're instigated and they end up biting a human or a large dog, it doesn't end up being as deadly as some of the other snakes that we can come in encounter with from other countries. The main location that we see the Massasauga rattlesnake is in and around the Great Lakes. So we don't really see these snakes beyond about 50 kilometers away from the Great Lakes. And the main population is in and around Georgian Bay and in Bruce County area. There is one other small population near Lake Erie. So to identify these snakes, you're looking for kind of butterfly-shaped spots along the back. They're kind of a dark brown to gray color. They only grow up to a total of about 75 centimeters, so about 3 feet in length total as an adult. They do tend to be kind of a stout, so kind of chunky little snake with a diamond-shaped head. The thing that really sets them apart from other snakes to identify them is that they have a rattle on their tail, and you can see that, but you can also hear it soon before you see it. You usually hear that little rattle sound. The other defining feature that makes it different from any other snake in Ontario is that their eye pupils, which most people probably won't get close enough to examine, are actually like a cat-shaped, kind of like a diamond-shaped pupil rather than the round that most other snakes do have. So with these specific snakes, they are pretty docile, they're pretty shy, they're going to hide in their environment, they're not going to come out. If anything, you'll probably hear them rattle to warn you that they're there, that they don't want to be disturbed. The main time that they do bite is if they're being bothered. So, you know, your dog goes into the bush and thinks it's pretty funny that there's, you know, something that's reacting to them, or someone goes and tries to catch it or pick it up. They will defend themselves with a bite in that case. Not every bite is venomous. So about 25% of snake bites from this particular rattlesnake are called dry bites. So they're biting on and not actually producing any venom. It still can leave a nasty bite and it still can be extremely painful. But with that 25%, there's no actual venom injected into the site. The prey that they eat are usually small mammals, so little mice, voles. Sometimes they can eat small reptiles or amphibians as well. But they don't want to bite humans. They don't want to bite dogs. Their intention is not to eat a small dog or a cat. So the main thing to do to avoid your dog from being bitten by a rattlesnake is, number one, make sure your dog is on a leash whenever you're in rattlesnake territory, especially dawn and dusk, hooking your dog to the leash with your skunks, your porcupines. You also don't want to encounter those snakes. They're usually during the day. Sometimes they can be out basking, but they're usually in a burrow. If your dog does get bitten by a rattlesnake, the best thing to do is take them directly into the vet clinic. If you're pretty remote, keeping them calm, carrying them out of the woods if you're on a hike, and getting them to your closest veterinary clinic. You don't necessarily need to go into an emergency center or seek somewhere that has a specific anti-venom. You just want to get them into the vet clinic and get them assessed as soon as possible. So always, whenever you're going camping or cottaging, knowing where the closest vet clinic is extremely important. So that's good research to do before you go. If you see where the rattlesnake has bitten your animal, you can rinse it off with some fresh water. Don't rub it. Don't try and suck the venom out. Don't apply ice to it. Don't bandage it. Just get them straight into the vet clinic. The venom is designed to kill small prey animals that these snakes usually eat, would be stunned, and then it starts to actually digest the tissues. In our small dogs and cats, there can potentially be that effect on them as well, especially depending on where they're bitten. On our larger dogs, on our humans, it doesn't tend to be fatal. Usually it causes a pretty severe wound where they've bitten, and it can cause some coagulation or some bleeding problems. When you first get to your vet clinic, what they'll do is they'll take in the dog, they'll do a full clinical exam first. Having your history of where you were located, what type of snake, if you have a photo of the snake, that's really helpful, and how long ago your pet was bitten and what location. And then going forward, they will do an assessment probably of blood pressure to make sure that they are cardiovascularly stable. They will likely want to do a basic bloodline, a blood test to see that all of the organ function is normal, as well as the potential of doing something called a coagulation profile. So that just looks at how the blood is clotting, whether it's clotting normally or not, or whether that venom has affected them in a negative way. Treatment includes potentially hospitalization and IV fluids if the patient is not stable. It includes using antibiotics or a dressing for the wound, as well as pain control. These bites can be extremely painful. In Ontario, anti-venom is generally not administered in animals unless the animal, it's going to be a life or death situation. Usually the anti-venom is not used. It's very expensive, it's very hard to get, and it usually expires before an animal comes in that actually needs it. So a lot of the times our veterinary clinics, even emergency clinics, don't carry it. So all in all, if we avoid our snake bites by keeping our dog on a leash, we really don't have a lot of problems with snakes attacking either dogs or humans. It's really an instigation rather than anything. These snakes, the Massasauga rattlesnake, are actually endangered in Ontario. It is actually illegal to kill them. So please don't be negative towards snakes. They do a fantastic job in our ecosystem to help keep populations in check. Thank you so much for listening. I hope this was helpful for you. And chances are, if your dog gets bitten by a rattlesnake and you do seek immediate veterinary attention, your dog will likely be just fine. Feel free to share this with a friend if you think it's helpful. Feel free to join us on Instagram at The Lovely Vet for our daily tips and tricks. And we'll see you again next week for our next episode. Thanks. Take care.